Yeah, so, there has been new nomenclature that's really shaped and changed kind of the world of hepatology. So this nomenclature really reflects, steatotic liver disease. And that's kind of a very official way of saying, disease in the liver due to fat, so steatosis. So we've known kind of in the developed world that really alcohol and fatty liver, so metabolic dysfunction associated steatotic liver disease, okay, are the two dominant diseases for liver in the developed world. So we've known in the past that oftentimes, metabolic risk and alcohol exist at the same time. We've separated them in the past, and that was when we had, non-alcoholic fatty liver disease and we had alcohol-associated liver disease. But now this new nomenclature, one, renames these, okay, so that there isn't the stigma associated with kind of using the word fatty. Okay, and then two is that it's really created this new disease called, MASLD with increased alcohol intake or MetALD. And that really reflects people who have at least one metabolic risk factor and increased alcohol consumption. That really reflects 20 or more grams per day for women and then 30 or more grams per day for men. And that roughly reflects, 1 to 2 drinks per day. If you have 1 or 2 drinks per day or more, and you have metabolic risk factors, but you aren't quite at that kind of, alcohol associated liver disease, okay, you are now MetALD. So that's really important now because one, we have a new way of really describing the patients that we're seeing in clinic. And two, now we have to really be able to really assess from a research standpoint, how are these populations different and how are we going to treat them differently? And are the interventions going to be different to be able to improve patient outcomes in the end? This study was really a national study. So it was looking at the NHANES database, which is really nationally representative. So, every kind of happens in 2 year cycles. So we looked at, participants that are nationally representative. Okay. And they have essentially very detailed alcohol intake assessment for metabolic risk factors. Um, and then as an outcome, we looked at, fibrosis 4 score or FIB4, which is really a surrogate for significant liver fibrosis. So, what we were particularly interested in, and there's kind of been, several questions that have kind of come up because of the nomenclature, but one of the controversies was, should MetALD be defined by just one metabolic risk factor, right? Because we know that alcohol can actually cause metabolic risk factors. So if you have just one and increased alcohol intake, is it truly a distinct disease, right? That was the question. So that was one of the questions that we really sought to answer. So we looked at, these participants and we looked at their metabolic risk factors and we counted the number of metabolic risk factors too. And then we classified patients based off of their alcohol intake. So what we found was that if you were increased alcohol user, by MetALD or ALD definition, okay, really the cutoff where you have a different risk of liver fibrosis is not with one cardiometabolic risk factor, but it's really with three or more. Okay, that's what was the optimal cutoff. So really, the take-home message here is, well, should we really be classifying MetLD not with just one, but really three or more cardiometabolic risk factors, and maybe having this kind of higher threshold for a cutoff would better differentiate the patient populations in steatotic liver disease. One is that it matters how many they have, right? How many metabolic risk factors they have. So if you have someone with three or more metabolic risk factors and increased alcohol intake, this is really a higher risk group for developing fibrosis. But that's not to say that, having no metabolic risk factors and having increased alcohol consumption isn't a risk. We know that alcohol is a large contributor to liver disease. But what it's really telling clinicians is that if you have patients who have three or more and increased alcohol intake, this is a high risk group. You have to be very aggressive with interventions, um, and particularly screening too. And then two is kind of another key finding that we found is that the association of each of these cardiometabolic risk factors with liver fibrosis is not equal. So we found that, diabetes, hypertension, high waist circumference were highly associated, but low HDL and hypertriglyceridemia were not. So this whole idea in the nomenclature, kind of treating these metabolic risk factors equally, that's probably an oversimplification. So that's another key takeaway is that, okay, you have metabolic risk factors, but there are probably some that are actually more important than others in terms of their contribution to liver fibrosis, especially, obesity and diabetes. Yeah, so kind of, this is really cross-sectional data, right? What would be really interesting now is that the question is, okay, well, if you treat these risk factors, does it actually improve outcomes, right? So we've shown that diabetes and obesity are kind of extreme risk factors for developing liver fibrosis in increased alcohol users. So kind of the natural question now is, okay, well, amongst people with, increased alcohol intake with the MetALD, well, treating kind of obesity or treating their diabetes improve their outcomes. And, we have new treatments for these, right? GLP-1s, incretins have really changed and revolutionized our field, but they're really assessed in MASLD right now, right? So the question is, will these findings translate or even be kind of maximized uh, in ALD, in ALD populations? That I think is a kind of a burning question, but a natural next step. Yeah, I think what's been very interesting, especially for the lay public, is that this kind of goes to the question to, well, some people drink heavily and some people develop liver disease and some people don't. So I think that this is kind of getting to that question, right? If you have underlying obesity, underlying, diabetes, underlying high blood pressure, you're actually at higher risk for developing liver disease at the same quantity of alcohol use compared to someone who doesn't have these risk factors, right? So it's really also getting at that question as well. What are the cofactors for developing alcohol associated liver disease?